You roll over in bed and it hits again, that deep, sharp ache in your shoulder. You try to lift your arm to adjust the pillow and it just won't go. There was no big injury, no fall, no dramatic moment. Just one day it was a bit sore. And a few weeks later, you're struggling to fasten your bra or reach in the back seat or put on a jacket without wincing. Your x-ray might look fine and your blood work might come back normal, and yet your shoulder feels anything but normal. If you're a woman in midlife, if you have prediabetes or diabetes, a sluggish thyroid, menopause symptoms, or that weird situation where your labs look okay, but your body definitely does not, you might have been told that you just have a frozen shoulder, almost like it's bad luck, an isolated orthopedic glitch. But what if that stiff, painful shoulder is not random at all? What if it's an early warning light on your connective tissue, pointing back to how your cells are handling energy, sugar, and inflammation? In this episode, we're going to treat your frozen shoulder like a clue that something deeper is going on with how your body is processing fuel. Long before a heart attack or a full-blown diabetes or major joint damage shows up, we're going to ask a bigger question. Could that one shoulder be part of a whole network of metabolic stickiness, from tendons to hands to spine, all whispering the same story about energy stress in your cells? I'm Chris Mearns, and this is the Fructose Model. Let's start with what you actually feel. Most people with frozen shoulder don't walk in saying, I have an adhesive capsulitis of the glenohumeral joint. They say things like, I can't sleep on that side. I can't hook my bra. I can't get my arm into my coat without doing this weird workaround. And at first it might just be pain, often worse at night. And then over months, the motion slowly disappears and reaching behind your back or overhead becomes almost impossible. Eventually, the pain can calm down, but the stiffness hangs around like the last guest at the party. Orthopedically, this gets labeled as adhesive capsulitis. That capsule, the soft envelope of tissue around the shoulder, gets thick and tight and stuck. And if you're looking at it during surgery, it can look almost like someone shrink-wrapped the joint. Here's the first strange clue. That shrink-wrapped shoulder doesn't happen evenly across the population. It clusters. People with diabetes have a much higher risk of frozen shoulder than people without. Several studies and reviews have shown that people with diabetes can have 2 to 4 times the prevalence of adhesive capsulitis compared with the general population. It also pops up more in people with prediabetes, metabolic syndrome markers, and with thyroid issues, especially hypothyroidism. So now the question changes. If this was just a random shoulder problem, why would it cluster with blood sugar problems, cholesterol issues, and hormone shifts like menopause and thyroid dysfunction? There are 2 possible stories. One, of course, is coincidence. As we age, we get more metabolic issues and we get more orthopedic issues, and they just overlap. The other story is more interesting. Maybe your shoulder shrink wrap is downstream of the same chemistry that's quietly reshaping your blood vessels, your nerves, and your organs. To see which story makes more sense, we have to zoom in on the actual material that's stiffening up, the collagen. Think about your shoulder capsule as a collagen-rich fabric. In a healthy state, that fabric is strong, but flexible. Fibers can slide and glide and remodel. And now imagine that fabric slowly getting sticky. Fibers start cross-linking. The weave thickens. It becomes less like a stretchy t-shirt and more like an old starched curtain. A big part of that stickiness comes from something called glycation. And that's when sugar and sugar-derived molecules latch onto proteins like collagen and form advanced glycation end products, or AGEs. Once those AGEs form, the collagen becomes stiffer, more brittle, and harder for your body to break down and replace. If your blood sugar runs high or even high normal for years, if your cells are under energy stress, you can end up with more AGEs in the collagen of your blood vessels, your eyes, your kidneys, and in the connective tissue of your soldier. But glycation may not be the entire story. One of the puzzles in frozen shoulder is that the tissue doesn't simply become stiff. It also seems to lose some of its ability to repair and remodel itself normally. That shoulder capsule becomes thickened, fibrotic, almost as though the tissue is responding to a low-grade stress signal that never fully switches off. And this is where the fructose model becomes interesting. Under certain forms of metabolic stress, cells can activate the polyol pathway, converting some glucose into fructose inside the tissue itself. And researchers have proposed that this locally generated fructose can increase oxidative stress, raise uric acid levels, and temporarily lower cellular energy availability. Not enough to cause obvious injury, but potentially enough to influence how tissues respond to stress and repair themselves over time. Now step back and look at the frozen shoulder again. We have abnormal collagen remodeling, fibrosis, microvascular changes, a condition that strongly clusters with diabetes, prediabetes, and other markers of metabolic dysfunction. And that doesn't prove fructose is responsible, but it does raise an intriguing possibility. What if frozen shoulder is one of the places where chronic metabolic stress becomes visible? Not as a blood test, not as a diagnosis, but as connective tissue that gradually loses its flexibility, adaptability, and its ability to heal the way it once did. Let's connect this back to your life. If you're watching this with an aching shoulder, you probably want to know one thing. Is this frozen shoulder a metabolic warning sign? Here's the direct answer. For many people, especially those in midlife, with prediabetes, diabetes, thyroid issues, or menopause shifts, frozen shoulder looks less like a random orthopedic fluke and more like a connective tissue expression of underlying metabolic stress. That does not replace standard care. You still need a proper diagnosis. You still need to rule out things like a rotator cuff tear, arthritis, or referred pain from the neck. And physical therapy and supervised movement and sometimes injections or imaging, all of that still matters. And if your pain is severe or you're losing function quickly, you should absolutely work with a clinician. But the reframe is this. Instead of asking only, how do I unstick this one shoulder? We might also ask, what is my connective tissue trying to tell me about my whole metabolic environment? If AGEs and low-grade inflammation are making your collagen stiffer, then dialing down metabolic stress might not just only help your A1C. Over time, it might change how your tissues age, how they heal, and move. And if that's true here, where else is the body telling the same energy story?